Health, Dr. Elias Mainambuthia, our Chief Officer of SK branch officials, KMPDU, esteemed colleagues, and all our partners. Good morning. Today we are very excited, Your Excellency, to be gathered here. As Kiambu County, we are very honored to be hosting the World Pharmacist Day celebrations 2024. And this is a day that is commemorated, Your Excellency, worldwide every September to highlight the pharmacist's vital role in the healthcare ecosystem, to provide high-quality healthcare services that are patient-centered. Your Excellency, gathered here today, we have pharmacists from Kiambu, together with pharmacists from the Central Region, that is under the PSK Tana Athi branch, who are from Muranga, Kiambu, and Kirinyaga. We have representation of pharmacists from public sector, academic institutions, as well as private sector, including manufacturing, distributors, and retail. Only a few are gathered here, Your Excellency, because our services have to continue in the facilities. I want to recognize the presence of our PSK officials and also our KMPDU. And today, as we celebrate World Pharmacist Day with the theme, Pharmacists Meeting Global Health Needs, we are looking at the evolving global needs and challenges and opportunities that exist for us as healthcare professionals. And we want to underscore that pharmacists are not just dispensers of medication. We are healthcare providers, educators, advocates for patient safety. Our expertise extends beyond the pharmacy counter, touching every corner of public health, clinical practice, academia, research, and drug development. We are all the way down to the ground, Your Excellency, including coordinating the CHP kits and ensuring that those medicines that are carried by the CHPs are safe for our patients to use, Your Excellency. We have pharmacists, Your Excellency, with a wealth of expertise in the county and in the region: clinical pharmacists, analytical chemistry, industrial pharmacists, supply chain specialists, pharmacoepidemiology and pharmacovigilance specialists, radiopharmacists, toxicologists, medication therapy management specialists, to name but a few. And we appreciate, Your Excellency, the support you have given us in continuous professional development. Your Excellency, as a department, we have received tremendous support from your government. Our health facilities are very well stocked with high quality, safe and cost-effective medicines. Your Excellency, we appreciate your support, that you ensure that we not only have medicines, but you allow us to source from reputable suppliers who give us a benefit of pricing and logistics for last mile delivery, Your Excellency. We are one of the few counties that have we do not have any outstanding debt with KEMSA, and thanks to you, Your Excellency, we really do appreciate that you support, Your Excellency. Additionally, Your Excellency, the Central Medical Store that is under construction in Ruiru, under your leadership, will be a game changer in ensuring improved availability of health products and technologies in our facilities. We appreciate this innovative and sustainable financing mechanisms in the county. We appreciate that we have ring fencing of our FIF, and additionally the social health insurance and particularly Kiambu Afya initiative, popularly known as Wamatangi Care, Your Excellency, that is now making it affordable to our population. And we are hopeful, Your Excellency, that benefit from these services. Particularly, we remember the elderly who previously accessed NCD medicines free of charge in our selected facilities, and they will also benefit from this. I want to just take one, just ask a few things. I know that time is not on our side, apologies. We appreciate, Your Excellency, the tremendous support and the fact that you have the people of Kiambu's needs, especially our patients, at heart. And I know you ensure that the Hakuna Dawa phrase is not something that is to be had in our facilities. We appreciate that, Your Excellency. And we have ensured, and we are putting good prescribing practices in place and dispensing practices in place through our medicines and therapeutics committees that will ensure that there is integrity and patients' rights are upheld, to ensure that no patients go outside to buy medication that are available in our facilities. And now to ask, we have a health products and technologies unit that is the mechanism where that coordinates and oversees all supplies of health products, and we ask that you empower the health products and technologies. We are requesting that you make it a directorate to better execute its mandate. We are also asking that you help us to streamline the procurement processes. Currently, there are delays in the procurement processes occasioned by the delays in approval of requisitions, and also because we do not have enough procurement officers in our facilities, particularly in primary healthcare facilities, our level 2 and 3s. Our ask is that you post sub-county procurement officers in all our sub-counties. Again, we are very eager to move to the Ruiru store. We are asking Your Excellency that you can fast track that for us to have the equipment required, state-of-the-art equipment, security systems, and a robust HMIS system that ensures there is end-to-end visibility of HPTs and enhances security and accountability and transparency. And again, Your Excellency, we hope the same can be replicated to improve our stores in all our health facilities and to also improve on the surveillance to enhance security in our stores, in all our facilities. Last but not least, Your Excellency, is on the human resource issue. Your Excellency, we have major gaps in human resource. We have our level 2 and 3 facilities, only about 40% have pharmaceutical personnel. And we are requesting that we have all our hospitals, and including our primary healthcare facilities, manned by pharmaceutical personnel. Your Excellency, I assure you that the medicines of the people of Kiambu are safe and well accounted for where there are true professionals. And where there are rogue professionals, we're in full support that due disciplinary measures and full force of the law be applied. To close, kindly, Your Excellency, consider a few asks. There are many, and we know that we will have more opportunities as we continue. And now, dear esteemed colleagues, as we celebrate this important day, which is our day, let us remember the impact we have on lives, one patient at a time, joining hands as private, academia, industry, community practice, and leadership. Let us strive to provide excellent pharmaceutical care that is compassionate and responsive to patient needs. Together we can rise to the challenges ahead and truly meet the global health needs of our time. Remember, you are the healthcare system. You are to the healthcare system what the engine is to a car. The healthcare system cannot move without medicines and the vital role the pharmacist plays.
Thank you, Dr. Esther. In addition, Your Excellency, we also appreciate the utility vehicle you gave us for Dawa Mashinani. We really appreciate so much. Dr. Kagwa.
Your Excellency, the Governor of Kiambu County, Dr. Kimani Wamatangi, Waziri by our county pharmacists. What I just want to say, we are proud you have created time for us. This is a World Pharmacist Day. It's normally celebrated on the 25th of September, but we thought to bring it today because of so many activities. In Kiambu, we are rolling out the polio activities and the SHA and everything. So mine is just to say thank you for creating time, and just to say the theme for this year is Pharmacists Meeting Global Health Needs. So pharmacists have been deployed even during COVID-19 for public health, and we are changing the practice of pharmacy from product-oriented to patient-oriented. And that's why the director is talking about patient safety, patient counseling. From here, Your Excellency, we are going to Kiambu. The whole day we are going to have a walk, go to Kiambu and talk to patients, those who are on chronic medications, just to advise them on how to use their medication safely and Excellency, for the support. I just want to invite our Waziri, Dr. Elias, to invite you. Thank you so much, sir.
Thank you very much. Your Excellency, I'll take a minute, I'll not take a lot of time. Number one, to appreciate you for finding time to come and meet these pharmacists who do a great job in our facilities, in our hospitals. They are very important, very critical. Your Excellency, as a department, we want to appreciate you and to recognize you for the effort that you have made. All our facilities have got enough drugs. Your Excellency, you have insisted that anytime in any facilities, we should not have not less than 85% of medicines available. If it goes below that, His Excellency would always insist that it should never, that's the lead line. We should always have 95%. Thank you very much, Your Excellency. Before Your Excellency, our pharmacists who are celebrating their day today, and you have heard from Moranga, from Kirinyaga, and from Kiambu. I want to thank them very much for choosing Kiambu to come and celebrate this day. And Your Excellency, they are not just here to walk and to be flagged off. They are going to the hospital to offer their services to our people. For that, I want to recommend them very much and to thank them very much. And with those very few remarks, Your Excellency, it's my singular opportunity to invite you to address
and colleague in that industry. Happy Pharmacist Day. And God is good
all the time.
and all the time.
God is good.
Asanteni sana. This morning I kept a tag had another team come in, and that's why all of you as our pharmacists in the county government. And tell you that we appreciate and we know that it's not an easy task in public service, especially, and at this time, coming from where we are coming from, with the aspirations we have, and the circumstances that we have been working under. Sometimes I know that you have to take the beating or the flag of so many mistakes that sometimes are not of your own making, sometimes where you have no say about, you become victims. And going through all those sequences and the areas specifically that it's been a long way and a long journey since when I came. We had a debt. We had a debt million when I took over. In the department, we had debts across, including other procurements, of almost 2 billion shillings in the entire health department. And so it's been a tough time trying to balance things. when I assumed office again in 2022, the debt owed in outstanding and allowances to our people, and especially in the health, was almost also close to yeah, 250 million. But slowly and surely, step by step, we have walked this journey with determination. And that's why, as county pharmacist has said, yesterday I was in a meeting in State House where we were talking about the disbursement of funds to counties as governors, and also discussing on our new healthcare plan, which I'll touch on as we finish. And in that sitting, I am proud to say that as the governor of Kiambu, when I stood up to make my remark, that still in the presentation and in the acknowledgement of KEMSA, we are one of the few counties, if not the only county, I don't know if there's any other, that owes zero, not a single penny to KEMSA. And that a climb up that has been very steep. We tend to keep it that way. And not only through KEMSA, because you've also touched on the reputation of the farms that we have allowed to be our source of drugs, to ensure that you dispense only drugs, medicines that are of a reputable source we can guarantee about. Even in our alternative supplier, meds, when we have to procure certain items from them, we've also made it very clear that one of the things that we cannot and will not compromise is quality. And even with meds, we also have where we have also cleared all our debts. So even in this has all been in my quest to ensure that we make that space where you sit and somebody comes to confront you, an old grandmother, a young child, an expected a man who probably may have had an accident or requires, and as has been said here, that we completely our dialogue of Hakuna Dawa. That's why we did those things. And I want to commend, because majority of you for all the times when I've visited various hospitals, I can see the spirit that they indeed want to get things right. Our communication when we discuss with them, that they are happy with the new system. Albeit there are a few acknowledged by county pharmacist, that we have a few cases that we need to address. And as you know, it is human nature that we are more attracted to that one little percent that is not right and ignore the 99% that is right. Oh, that's good. And so if you go today to every single medical facility, the more than 123 today that we have, you will probably barely find any facility that has got less than 80% stock of drugs. But when you go out there to our members of the public and ask them, what is the situation in our hospitals? You find that rhyme is still at Hakuna Dawa. We have steps to take, my colleagues, to ensure that we eliminate that from people's mouths, from their psyche, from their terminology and their dialogue. One is to ensure, and this is where we would need your cooperation, even as I address some of the things that you asked us to help in doing. Number one, I would request and propose that within the medical network of the medics within a facility, that you as our pharmacists take a central role and an involved position processes to ensure that what you know is the medicines or drugs that are supposed to be used in your facility, whichever are popular or more consumed, have a say in what is procured. And why do I say so? Because on a few occasions when you've gone out to the facilities, you find that there is an excuse that you can't excuse either. That we have drugs in the store of a certain regimen which would treat a certain malady, but because a prescription as has been written down specifies a different regime, but to cure a similar malady or similar disease, that a patient will walk out of that facility without drugs. And when they go out there, they greet their friend. As they're walking along, they say, nimetoka hapo kwa this level 4 hospital, level 5 hospital, na nimetumwa pale kwa chemist, na hakuna dawa. Lakini tukikuja, tukifungua nini, bado dawa zimejaa. And if there is any pharmacist here from you, among you from Igegania hospital, I don't know whether there is, if there is one, you remember I came to that facility one time, and I was not amused then, because we went to the pharmacy and we opened the pharmacy, and in a whole corner up to the high ceiling were medical supplies, drugs that were expired and were waiting to be destroyed. A whole, probably a quarter of the store. And my question was, why? Why would we procure such a huge consignment? Yet we have other hospitals where people probably went to a chemist and were told hakuna dawa of the same. And that's why I want to implore you on that one account, please, when prescriptions are being written, when there is that dialogue, have that universal discussion. And I've said this should know, and our doctor should know, our clinical officer should know that these are the drugs that have been ordered for, so when you're prescribing, this is what you prescribe. Secondly, this you may not have a lot of say on, is how do we also their way to the front, pharmacy, where you that synchronicity and efficiency. I'm not here to victimize, but I've been to quite a few of our facilities. And then when I went to one with the dispensing, you find that he has 1 or 2 or 3 bottles of what they are supposed to dispense of to patients. Then I asked, what about the other regimes? No, they're in the store. So supposing a patient comes and he wants this particular drug, what will you do? The storeman has the key. So I'll just call. So I said, okay, fine, call him now. Let's go see. Now, one time I was in Gatondo. So when we said call now, let's see, supposing I'm a patient, what will happen? We called, and then the guy with the key was somewhere in Gatundu North. And that time, I'm in Gatundu town. And then after lengthy calls, well, and then I'll take a border, I'll do what, I'll come, I took about an hour before the guy arrived. Same thing happened sometimes when I was in Kikuyu. There has to be efficiency, my friends. There has to be efficiency. And I believe that as a pharmacist, that's something you can be able to do, you can be able to do something about. Our central medical store is 95% complete. The only thing we need to do is fix shelving, a few important equipment there like refrigeration and others, which we have already placed on our to procure list. And so I want to assure you that that one we are going to procure within no time. And God willing, before December this year, we will have commissioned that facility. We have procured vans like this. I think we procured 2 now. Yeah, we procured 2 now. And these vans, Dawa Mashinani, are intended to also remove, once we have dealt with, once we've opened that facility, to remove the logistical hitches that would be there in distribution of drugs around. Thirdly, I want to finish quickly because I can see from that side the sun is hotter than where I am. Thirdly, is you are aware that we have also started to roll out our HIMS, the Health Information Management System. We have piloted and started in Kiambu. We are in Thika. We did in one of the facilities in Ruiru. After we get a clean bill of health from you, the users, we are ready to roll it out to all our facilities. And that will also give us a higher level of efficiency in terms of what you're doing. The control unit that you referred to, I want to propose that as the in charge of the county chief and waziri, let me get to precisely in a better way what it is that you do or you want to do. Work environment, our services better, then I'm certainly going to do it. There's no reason why I will not. Give it the flexing powers that it requires to be a directorate and have operational. Lastly, and most lastly, I have made it my personal commitment that we are not going to have a about failure to pay your salary. Because I see my friend there, if we were in a more friendly environment, you know, where it's opportunity to say 1 or 2 things, because he knows a few things and that we have done, and that it is not as it used to be, it is better now. And including the tested question about your payment for gratuity and promotions, that I have made a personal commitment. Here, when I was just new in office, we took a leap of faith. And I made a commitment and indeed enacted it and increased through promotions and increased. We are now absorbing of more than 100 million per year to promote, which we did. For those that are remaining, and I know there are many, as you've seen, we are on a journey that's moving upwards. I'll be asking for your support as much as you can support us. We have increased our own source revenue from 2.9 billion to 4.58 billion, almost 4.6 billion. If we move at that pace, there is no reason, and I have no excuse, not to promote the rest that have remained, even increase their salaries as we move on. I just want to make an appeal, because you also made requests. I also want to make an appeal to you. One, I have two. First is, please, my friends and my colleagues, my countermates, my workmates, let us watch this basket where all our eggs are in together. It is our basket. It is not basket. It is not somebody else's basket. It is all our basket collectively. What do I mean? That kitty where 2, 3, 4, 5 shillings just as compensation for services we've given. And you know we are not a profit-making entity when we are in this public service. Please don't let anyone put their hand in that till. They are causing us a lot of harm. In the health department, a significant decline in the last quarter, even beyond that 1 quarter. Because if I paid a debt of 500 million when I came in within a year in the health sector, if I settled and paid those that were being promoted and increased and zeroed all the debts from KEMSA to MEDS, how is it that in the last quarter and another maybe 2 months above, we have stagnated completely without any increment to our collections? Indeed, even declined. So I want to request you, because I can see all the faces I'm seeing here of good people, look for those bad people out there because there are some that are doing things there that are hurting us. Please don't allow. Do not. My last request will be, let's also selfless service to our people. And I know you do a lot. I know you try in postings of adequate staff where you serve. But we can hold out a little more and do a bit more where you are. A good relationship with our people. I want to request you, when from your mouth, that come from your mouth, let them be hope and courtesy and respect to our people. Please. So, and once we do that, even though there may be hardships as we move on, I believe all that is doable. I want to wish you a beautiful, brilliant, that together as a county government, this agenda of the devolved function of health and I promise you this as your governor, that God willing, this 5 years, but even if I don't, but I believe I will, because you guys tutasaidiana. If we get that time, that the day I leave this office after those years, after me, and bring down the gains that we will have made together with you, and you'll be serving in a better environment. You'll be serving. Those words are intended to tell you this, that I am committed. You're working in a space, in a place where you're respected, where you are compensated. Also, our responsibility as a government. So God willing, najua tutaendelea vizuri. So asanteni sana.
Kuna hawa watu wa kuna hawa watu wa banki kwa tunasaidia na pia hawa watu kutoka Mississippi. Hapa tutoka Thank you. One, two, three, four.